The muscles that act on the lower limb cause movements at the hip, knee, and foot. They are some of the largest and strongest muscles of the body, and many of them span two joints and can cause movement at both of them. For this reason, the terms origin and insertion are often interchangeable depending on the activity. In this series, we will first discuss the anatomy, origins, insertions, and actions of each major group, followed by a common clinical correlation pertaining to the particular compartment of muscles. Muscles acting on the thigh are massive and help hold the body upright against the force of gravity. Because of this function, they are sometimes referred to as anti-gravity muscles. Collectively, they are used for stability, locomotion, and maintenance of posture. Most cross two joints and have their origin on the pelvic girdle and insert on the femur. The psoas major and iliacus muscles have separate origins, but share a common insertion on the lesser trochanter of the femur. Thus, these two muscles are referred to as the iliopsoas and function to flex the thigh at the hip joint and rotate the thigh laterally. The group also act to keep the upper body from falling backward when we are standing erect. If the origin and insertion are interchanged, then the iliopsoas can be used to flex the trunk on the hip as when doing sit-ups. On the posterior side, there are three gluteal muscles that cause movement at the hip joint. The gluteus maximus is the largest, heaviest, and most powerful muscle of the group, and is the most superficial muscle of the hip. It is the main extensor of the femur, which means that it acts to bring the thigh in a straight line with the pelvis. It also aids in rotating the thigh laterally and abducting it. It plays very little role when we walk, but it is the most important muscle for extending the hip when power is needed, as when climbing stairs, running, and jumping. It inserts on the gluteal tuberosity and IT band. The gluteus medius lies mostly deep to the gluteus maximus. It runs from the ilium and inserts on the greater trochanter of the femur. The gluteus medius is a hip abductor, medially rotates the thigh, and is important in steadying the pelvis when walking. It is also a common site for intramuscular injections, particularly when more than 5 milliliters is administered. Although the gluteus maximus is more superficial, the medial part of the muscle overlies the large sciatic nerve, and so this area must be avoided. The gluteus minimus is the smallest and deepest of the three. It lies deep to the gluteus medius and functions to abduct and medially rotate the thigh. The gluteus minimus also inserts along with the gluteus medius on the greater trochanter of the femur. The muscles acting on the thigh and muscles of the thigh that move the knee are wrapped in tough, deep fascia called the fascia lata. The fascia lata encircles the entire thigh and ensures that when the powerful muscles contract, their force is not dissipated by bulging. The fascia and the tendons of the gluteus maximus and a muscle called the tensor fasciae lati form the iliotibial tract or band, which is a tough, thick band of dense CT made up of collagen. The IT band inserts into the lateral condyle of the tibia. If not stretched out adequately, the tensor fasciae lati tightens, pulling on the IT band. Since the band is made of bundles of collagen fibers, it has a limited ability to stretch. The pulling on the band causes pain on the side of the knee where it inserts on the lateral condyle of the tibia. The muscle named the tensor fasciae lati arises from the lateral surface of the thigh, having its origin from the iliac crest and insertion on the tibia by way of the IT band. The tensor fasciae lati flexes, medially rotates, and abducts the thigh at the hip joint. It is also important for supporting the knee. Deep to the gluteus maximus and medius are a group of small muscles that have their origins on the pelvis ischial spine, ischial tuberosity, and obturator foramen, and insert on or near the greater trochanter. The muscles are the piriformis, obturator internus and externus, superior and inferior gemellus, and quadratus femoris. These muscles function to laterally rotate and abduct the thigh at the hip joint. In the unit on the nervous system, we will learn that the sciatic nerve is the longest and biggest nerve in the body. It leaves the vertebral column from the lower lumbar and upper sacral region, and its branches extended from the gluteal region to the toes. The sciatic nerve enters the posterior thigh by passing under the piriformis muscle. If this muscle becomes inflamed and swollen from overuse, or inadequate warm-up or cool down from exercise, it can pinch the sciatic. This can result in a range of symptoms from a pain in the gluteal region to pain in the posterior thigh, calf, and toes. Muscles that act on the leg have their origins from the hip and slash or thigh and insertions on the tibia. These muscles are divided into three functional compartments by deep fascia. The medial compartment is also known as the adductor compartment because muscles that adduct the thigh are bundled together along with their vascular and nerve supply. The muscles of the medial or adductor compartment adduct the thigh at the hip joint, medially rotate the thigh, and flex the leg at the knee joint. The anterior compartment is also known as the extensor compartment. It is occupied mainly by the muscles of the quadriceps femoris group and the sartorius. The posterior compartment is the flexor compartment and is occupied by the hamstrings, which extend the thigh at the hip and flex the leg at the knee joint. The picture on the left shows the muscles of the adductor compartment, which includes the adductor magnus, longus and brevis, and the pectineus and gracilis. All of these muscles have their origin on the inferior ramus of the pubis and insert on the medial surface of the tibia. The picture on the right shows the muscles of the anterior compartment. The quadriceps femoris has 4 heads of origin. The rectus femoris originates from the anterior iliac spine. The vastus lateralis comes from the greater trochanter and linea aspera of the femur. The vastus medialis also originates from the linea aspera, and the vastus intermedius arises from the anterior and lateral surfaces of the body of the femur. All 4 heads insert on the patella via the quadriceps tendon, and then the tibial tuberosity via the patellar ligament. All 4 heads of the quadriceps femoris extend the leg at the knee joint, and the rectus femoris also flexes the thigh at the hip when acting along. The sartorius forms a band across the thigh from the ilium to the medial aspect of the tibia. The sartorius flexes the leg at the knee, flexes, abducts, and laterally rotates the thigh at the hip. It allows us to sit cross-legged. Sartorius means tailor, and back in the old days, tailors would sit cross-legged on the floor as they worked. Groin strains make up 2 to 5% of all sports injuries. They are a common problem in sports where quick change of direction is required: football, baseball, soccer, etc. Groin injuries affect the adductor compartment, the adductor magnus, longus, brevis. The pectineus or gracilis can be involved. Groin injuries are difficult to heal. Sometimes the muscle tears from its tendon. When the injury finally heals, there is usually scar tissue surrounding the point of injury. The posterior or flexor compartment contains the hamstrings, which are all separate muscles. The hamstrings include the biceps femoris, semitendinosus, and semimembranosus. They span 2 joints, the hip and the knee, and function to extend the thigh and flex the leg. As the name indicates, the biceps femoris is a 2-headed muscle. The long head arises from the ischial tuberosity, and the short head arises from the linea aspera. The insertion is on the head of the fibula and lateral condyle of the tibia. The semitendinosus and semimembranosus both originate on the ischial tuberosity. The proximal part of the semitendinosus inserts on the medial surface of the shaft of the tibia. The semitendinosus inserts on the medial condyle of the tibia. The roof of the popliteal fossa is bordered laterally by the tendons of the biceps femoris and medially by the tendons of the semitendinosus and semimembranosus. This diagram summarizes and illustrates the actions of the muscles located in each of the 3 compartments of the thigh. The muscles of the anterior compartment act to extend the leg and are all innervated by the femoral nerve. Muscles of the medial compartment adduct the thigh and are innervated by the obturator nerve. The muscles of the posterior compartment of the thigh flex the leg and extend the thigh. They are innervated by the tibial division of the large sciatic nerve. Pull or tear of the proximal hamstring. Common in sports with hard running, quick starts and stops. Part of the tendinous origins of the hamstrings can be torn from the ischial tuberosity. Biceps femoris is the main muscle injury. There are several grades of severity of hamstring injuries. Grade 1 involves stretching of the muscles which result in slightly pulled or excessively stretched muscles, or very small tears in your muscles. You will generally feel some specific point pain, tightness, or mild cramping. Grade 2 hamstring strains are more painful and involve a partial tearing of the hamstring fibers in your muscles, tendons, or at the tendon attachment to your bone. You will generally experience some pain that radiates down your leg during activity while bending your knee against resistance or when you touch your hamstring. There may also be some bruising as a result of bleeding in the muscle. Grade 3 hamstring strains involve a complete tear rupture of your hamstring muscle, fibers where your muscle belly attaches to your tendon or where your muscle belly rips in two separate pieces. It is very painful and rarer than the other strains. You will tend to experience a burning or stabbing pain, a lot of swelling and minimal strength, which may prevent you from walking without assistance or make it difficult for you to move your leg. The information on grades and symptoms. Prevention of hamstring injuries requires properly warming up, stretching, and balance of development between hamstrings and quadriceps. The leg refers anatomically to the part of the lower limb below the knee. The crickstrinsic muscles that move the foot, ankle, and toes have their origins on the tibia or fibula outside of their site of action on the foot and toes, thus the designation extrinus. As with the thigh, the musculature of the leg is divided by deep fascia into 3 compartments. The anterior compartment contains muscles that dorsiflex the foot. The tendons of these muscles are held firmly to the ankle by the superior extensor retinaculum, also known as the transverse ligament of the ankle, and the inferior extensor retinaculum, or cruciate ligament of the ankle. The retinacula are tough bands of collagenous connective tissue. The muscles of the anterior compartment include the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the fibularis peroneus tertius part of the extensor digitorum longus. The lateral compartment contains muscles that plantar flex and evert the foot. These are the fibularis peroneus longus and brevis. The posterior compartment includes deep and superficial muscles. The superficial muscles include the gastrocnemius in the first layer and the soleus and plantaris in the second layer. The plantaris may be absent in some individuals, or there may be 2 per side in other people. The superficial muscles insert into the calcaneus via the calcaneal Achilles tendon and act to plantar flex the foot at the ankle. The deep posterior compartment includes the popliteus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. As mentioned in the previous slide, the third and deepest layer include the popliteus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. These muscles also plantar flex the foot at the ankle joint. In addition, the popliteus flexes the leg at the knee and medially rotates the tibia to unlock the extended knee. The flexor hallucis longus inserts on the distal phalanx of the great toe where, in addition to plantar flexion, it flexes the hallux. The tibialis posterior is the antagonist of the tibialis anterior. It plantar flexes and everts the foot. Shin splints are characterized by pain along the medial and distal 2/3 of the tibia. There are several causes. Tendinitis of the anterior compartment muscles, which is related to poor conditioning. poor shoes or running on hard or banked surfaces. Inflammation of the periosteum, called periostitis, and stress fractures in the tibia. The musculature and overall architecture of the foot is similar to, and every bit as complex as that of the hand. The foot, however, is adapted to withstand the weight of the body and to function in locomotion, whereas the hand is used to manipulate objects. The intrinsic muscles of the foot have both their origins, insertions and actions on the foot. They function in support and locomotion, but not precise movements. The intrinsic muscles of the foot flex, extend, abduct, and adduct the toes, and support the arch. The muscles are divided into two groups, but there is only a single muscle on the dorsal aspect of the foot, the extensor digitorum brevis. This muscle has four small parts to it. It lies deep to the tendons of the extensor digitorum longus and corresponds to the extensor indicis muscle of the forearm. The medial slip of muscle corresponds to the extensor pollicis of the forearm and is sometimes called the extensor hallucis brevis. Its origin is from the anterior part of the calcaneus, and it inserts on the base of the proximal phalanx of the great toe and parts of toes 2 to 5. It helps to extend toes 2 to 5 at the metatarsophalangeal joints. The plantar aspect or sole of the foot consists 4 layers. The first layer is the most superficial and contains the abductor hallucis, flexor digitorum brevis, and the abductor digiti minimi. The abductor hallucis has its origin on the calcaneal tuberosity and plantar aponeurosis. It inserts on the proximal phalanx of the great toe. Obviously, it abducts the great toe. The flexor digitorum brevis corresponds to the flexor digitorum superficialis of the forearm and inserts into the digits the same way. Its origin is from the calcaneal tuberosity and it inserts on the middle phalanx of toes 2 to 4. It helps flex the toes. The abductor digiti minimi is the most lateral of the 3 muscles of the sole, similar to the abductor muscle of the palm. It originates on the calcaneal tuberosity and inserts on the lateral side of the base of the proximal phalanx of the little toe. The second layer contains a 4-sided muscle called the quadratus plantae that arises via 2 heads from the medial and lateral sides of the calcaneus and inserts on the tendon of the flexor digitorum longus. It straightens out the oblique pull of the flexor digitorum longus. The lumbricals originate from the tendons of the flexor digitorum longus and insert on the extensor expansion on the proximal phalanx of toes 2 to 5. By pulling on the extensor expansion, they flex the toes at the metatarsophalangeal joints and extend them at the interphalangeal joints. The third layer consists of the flexor hallucis brevis, adductor hallucis, flexor digiti minimi brevis. The fourth layer contains the dorsal interossi and plantar interossi. The dorsal interossi acts to abduct the toes 2 to 4 and extend the distal phalanges, and the plantar interossi abduct toes 3 to 5, flex the proximal phalanges, and extend the distal phalanges. Plantar fasciitis is also known as painful heel syndrome. It is an inflammation of the plantar aponeurosis at its origin on the calcaneus. The aponeurosis becomes less elastic with age, but other causes include chronic irritation, weight-bearing activities such as walking, jogging, and carrying heavy objects, inadequate support or poorly fitting shoes, being overweight or poor biomechanics of the feet such as flat feet, high arches, or gait abnormalities.